Hello friends, I am Dr. Yogesh Vaidya, a consultant orthopedic and joint replacement surgeon at Pinnacle Ortho Center Hospital. I warmly welcome you to this new session of Facebook Live. Now as we enter into the third phase of our Unlock India, let us discuss some points in how we have started to unlock our surgical and routine OPD work at Pinnacle Hospital so as to inch towards normalcy. As we trace our journey towards the normalcy, let us start the whole story from the month of January, wherein on 30th January the first case of COVID-19 was detected in India. Till that time we had just heard about some cases here and there in China, Europe and the Western world. But till that time we were totally unaware that the enemy had come at our doorstep. We were totally unaware that such a huge disaster was waiting for us in the near future. On 22nd March, our Honorable Prime Minister Mr. Narendra Modi had in fact asked for a voluntary Janta curfew, and which was later on turned into a total lockdown starting from 24th of March. This was initially a 21-day lockdown followed by another lockdown followed by another lockdown till towards almost the end of month. The whole India with its own population of 130 crore people was in entire lockdown. To understand why this lockdown was done, let us first know a little about this coronavirus. This coronavirus is basically transmitted by aerosol. So it can be transmitted when one person comes in close contact with the other through droplets or by sneezing or by coughing or by touching on contaminated surfaces. This virus is a heat sensitive virus. It can also be destroyed by ethanol or hypochlorite or chlorine containing solutions. Now, what is basically the science behind any lockdown? To understand that, we need to know that lockdown is basically to break the chain of transmission of this virus. This virus, as it spreads by droplet, so once people are in lockdown, it means that less people will come in contact with each other. There will be less crowding, so the transmission will be less and the curve or the epidemiology or the spread of the disease can be flattened out. But the most important reason why any lockdown is enforced is to give us time for the healthcare to prepare itself for any disaster. In the lockdown period, all the hospitals were advised to close down their routine services. They were advised to shut down their elective surgeries. Even in our Pinnacle Hospital, we had virtually shut down our OPD. We were only attending to emergency cases. We were only admitting only emergency fracture patients or any spine related emergencies, as in sense of cauda equina syndrome or any neoplasm or any cancer patients who were in their chemo or radiotherapy window. So virtually we had to shut down all our routine services. So this lockdown helps us to build our infrastructure, create more beds to deal with this infection. It also helps to keep our healthcare workers, our doctors, and to prevent our resources like mask or PPE kit and all the things which are needed for fighting this pandemic to be prevented from getting exhausted. Now that we are over a period of time, we have been, I would say, little successful in controlling this infection. We have come to know of treatment strategies which are helpful in fighting this infection. Even we have seen that the number of cases which are coming up have started to decline. The hospital beds are relatively now started to be a little free. There are ICU beds are also started to be a little free. The burden on the healthcare system has slightly started to get reduced. So considering all these things, we have now in Pinnacle Hospital decided that we will resume our elective OPDs. We will resume our elective surgeries. So this unlocking of our lockdown in Pinnacle, I would like to divide it into three things. One is how we are dealing in our OPD services. As far as possible, we are encouraging our patients to do teleconsultation or video consultation so as to avoid them from coming to the hospital. Our orthopedic patients are mostly elderly patients with diabetes or hypertension and other comorbidities. This is the most vulnerable age group for this coronavirus infection. So we are trying to tell them, as far as possible, you don't come to the hospital. We can provide you with tele consultation, or we can provide you with video consultation. But still, those who are patients who need to be physically examined or who need to be seen in person, they can come to the hospital. Now what we have done at Pinnacle is that we have created a reception area wherein a thorough history of the patient in terms of any fever, any travel history, or any infection in the family, or any occupational exposure, or any history of any clustering or crowding is taken. He is checked for, screened for temperature. He is advised, check for the temperature, and then only he is sent into the main OPD area. Even in the OPD area, the appointments are spaced out. Like in only 1 hour, we advise only 4 to 5 appointments. The seating arrangement is also spread out so that the social distancing is maintained. There is not too much of crowding in the OPD area. What we have done is that even in the consulting room we have made sure that there is a fresh ventilation which is there, so as to avoid the air from getting contaminated for a long time. We see to it that the movement of the patients in the reception area is also reduced. Any inter-department references are also done in a very different way. Now coming to the IPD services, as far as possible, we are not admitting any elective surgery patients. So whichever patients require any elective surgeries, they are thoroughly investigated on the OPD basis, rather over investigated on the OPD basis. We do their all the routine investigations, we do their RTPCR, we do their chest X-ray, and even HRCT if it is needed. Once the reports are available, once the patient is deemed fit and negative in terms of coronavirus, then only we are admitting these patients. Whereas in case of emergency patients who need emergency admission, such as fracture neck of femur or any other compound fractures, what we have done is we have created a triage area or an isolation ward which is on a different floor as regards the entire hospital floor. So once the patient is admitted, he is admitted preferably in a single room in isolation with minimum relatives, or rather no relatives with the patient. We are doing all his investigations in terms of RTPCR, his X-ray chest, his HRCT, his blood reports. Once everything is normal, then only we are shifting him into the mainstream of the hospital. If there is any issues with the reports, or if he is found to be COVID positive, as there are a lot of asymptomatic COVID patients, so he is then shifted to either a COVID care center or a designated COVID hospital, depending upon the intensity of his illness. Now once the patient is ready to be posted for surgery, there are certain changes which we have done in our operation theatre system. Initially we had the laminar airflow system, but in this case of coronavirus, it is advised that the laminar airflow theatre should be avoided, for the simple reason that the air can get circulated and it can get distributed through the centralized AC into the other non-infected parts of the hospital. So we have created negative pressure operation theatres. We have minimized the trafficking of the staff in the hospital OT. Very minimum staff is there. Plus we have avoided the use of any hoods or helmets. We wear N95 mask with a face shield and PPE kits in the theatre. As far as possible, most of the patients are operated under regional anesthesia. General anesthesia is avoided unless it is mandatory to be given. So we have gradually started the elective surgery, starting with some basic surgeries like short procedures or daycare procedures, and now we have even gradually started to do the arthroplasty and arthroscopy services, and even spine surgeries. One thing peculiar to orthopedic surgery is there is something called as AGP, or aerosol generating procedure. In orthopedic surgeries, there is a generation of lot of aerosols during the process of bone drilling or use of power tools, or pulse lavage, or even electrocautery. So one of the reasons for the spread of this virus is these aerosol generating procedures. So one has to be really careful when using all the above tools, like power tools or electrocautery. One has to be really careful. now once the patient is operated, we shift him into the ICU or the post-operative ward, wherein he is nursed by staff nurses wearing N95 masks and PPE kits are used. We have seen to it that the post-operative stay of these patients is reduced to the bare minimum. We do not allow any relatives to stay with the patient so that any risk of infection or cross infection is reduced. Another thing I would like to say is that there is a special and a detailed consent which is taken prior to the surgery, because there have been studies which have shown that there is a high risk of high chances of patient developing a post-operative COVID infection initially, which he was negative for. So this can lead to any litigations in the future. It has also seen that these elderly patients have a higher chances of mortality up to the range of 20% in the post-operative period. So all these precautions and all these care have to be taken. In the post-operative period, the rehabilitation, or we see to it that maximum the rehabilitation and the physiotherapy is done at the home of the patient rather than doing it in the hospital. So all in all, if you see, right from the arrival in the OPD till the discharge, we have made certain measures, taken certain measures as regards the patient care, patient safety, and reduce the chances of infection from the hospital to the patient, or the doctor to the patient, or the staff to the patient, and or his relatives or the patient transferring it to the hospital staff. So I would request you that you can feel free and you can feel absolutely safe to come to Pinnacle Hospital. We have all the safety standards over here as per the WHO guidelines or ICMR, with use of mask, N95 mask, PPE kits, social distancing, everything is followed. So you can absolutely rest assured that your patients are in safe hands, and we would like to now gradually unlock ourselves to provide all the orthopedic services to you all. Thanking you.